Imagine waking up one morning to discover that 420,000 of your neighbors and friends in Utah are suddenly at risk of losing the affordable health coverage they depend on. That's not just a headline. It's a real possibility unless Congress steps up soon. So why is this happening, and what does it mean for you? Let's break down the issue, and here's where things get surprisingly complicated. I'm Francis, President and CEO of the Utah Hospital Association, and I'm here to clarify a topic that affects nearly 1 out of every 8 Utahns. We often think of health insurance as something you'll get if you're lucky, but the truth is, it's essential. It protects families from financial catastrophe and ensures regular access to care. The entire system hinges on federal tax credits that help cover premiums for those shopping on the marketplace. Credits set to expire at the start of 2026. If Congress fails to renew them, Utah faces a crossroads. Thousands will be forced to give up their coverage or stretch their budgets past breaking point. Consider this: a young couple living in Utah County, both working full-time, raising 2 children. Their jobs don't offer insurance, but thanks to the federal marketplace, the family can afford checkups, vaccinations, and preventative care for their kids. Here's the part most people miss. Without these premium subsidies, their monthly payments would skyrocket, potentially forcing them to choose between keeping health coverage and paying the mortgage. This painful situation isn't just theoretical. It's actually what thousands of families in Utah go through every month. Now, Utah doesn't just participate in the marketplace, it leads. According to the Kem C. Gardner Policy Institute, Utah ranks 4th nationally in marketplace plan enrollment, with an unusually high number of children relying on these plans for everything from routine doctor visits to emergency care. In fact, more children here depend on marketplace coverage than anywhere else in the country. For families, that means their kids receive care before sickness becomes urgent and expensive. Imagine the difference between catching a cold early and ending up in the ER, both for the family's well-being and for the cost borne by everyone. Here's the controversial question. What happens if thousands lose that safety net? The answer isn't pretty. Without insurance, people often delay care until their health deteriorates, which leads to more emergencies, higher costs, longer recovery times, and a heavier burden on local hospitals. Marketplace coverage isn't just about keeping Utahns healthy earlier. It saves our entire system millions in avoidable ER visits and hospitalizations. But health is only part of the story. Utah is famous for its thriving small business sector and innovative economy. Affordable marketplace coverage is a crucial advantage for small business owners and entrepreneurs who typically struggle to offer traditional insurance plans but can attract talent knowing workers have options through the marketplace. Extended premium assistance is directly tied to Utah's track record, strong jobs, low unemployment, and a vibrant business community. This is why experts say letting these tax credits lapse would hurt not just individuals, but our entire state economy. Now, here's where the debate gets heated. Critics argue we could replace the marketplace with something better. Sounds good, right? But ask yourself, what happens to those families until that new system arrives? If Congress allows tax credits to expire without a viable alternative, hundreds of thousands, including parents, children, and small business owners, will be left with nothing. Congress now faces a stark decision. Do we allow affordable health coverage to collapse for 420,000 Utahns, or do we extend premium assistance and uphold the health, security, and prosperity of our communities? For me, the answer couldn't be clearer. Utah's strength comes from our traditions, robust families, and the spirit of entrepreneurship. Making sure people can access private health insurance honors those values and keeps our state competitive. There shouldn't be any disagreement about what's at stake. Preserving affordable coverage is about keeping families safe, supporting hospitals, and boosting the economy. I strongly urge Congress to act now. Utah's families, children, and small businesses simply can't afford to wait. Now let's get controversial. Should protecting affordable coverage really be a partisan issue, or is it something we all have a stake in? Do you believe Congress will step in, or should Utah try to find its own solution? Share your thoughts in the comments below. Would you be willing to risk losing healthcare for yourself or your neighbors while waiting for something better? Or is action needed right now?